So deoxygenated blood is also going to come through the vena cava, which is this big breadstick-looking guy right here. Here, I'll get out of the way. We have the superior and inferior portions of the vena cava. Okay, the vena cava superior end is going to take in deoxygenated blood from above the diaphragm. So all of this up here from the head, the arms, and about halfway down through the chest up until the diaphragm. The inferior vena cava is going to take care of anything left over from the superior. Stuff below the diaphragm, so your legs, your feet, the inguinal area, your groin, your butt, that general area. So blood's going to come up, come down, come back from the coronary sinus into the right atrium. Which right atrium is going to house one of the most important structures within the heart. Within the heart entirely, which we'll talk about in just a little bit. So the right atrium, blood's going to come in through there, and it's going to shoot its way into this big chamber right here, which is called the right ventricle. Now, the right ventricle is what's going to cause the pumping through both ventricles are going to cause blood pumping away from the heart. The left ventricle is a little bit stronger than the right. We'll get into that in just a little bit as well. Okay, so then blood then is going to come. I'll save that for later. Let's go into the right side. Oxygenated side. You have your left atrium and your left ventricle, just like the other side. It's almost symmetrical. They're a little bit structured differently, but they do the same exact thing. Okay, so you have your right atrium, right ventricle, left atrium, and left ventricle. Same stuff, just different sides. Remember, the left side would be the right side to your perspective. The left side means the left to the patient's perspective. Okay, so let's get into another blood vessel group here. I didn't mention the pulmonary trunk, which is going to come from the right ventricle. Blood is going to come from the right ventricle up through the pulmonary trunk, which is this guy right here. And this is going to send deoxygenated blood to the lungs, which are just right around like that. So these two tubes are going to take the right and left pulmonary arteries, respectively, going to the lungs, and they'll come back to the heart. Now, I guess we should establish arteries and veins. Normally you would think arteries would carry oxygenated blood and veins would carry deoxygenated blood. That is true, however, there's always an exception to every rule, and this is one of them. Actually, we have another one right there. We'll talk about it in a sec. The pulmonary trunk is actually an artery. Artery, what it really means is it's carrying blood away from the heart. Okay, artery A, away A. So artery away, A away. Okay, so that's going to carry blood to the lungs, and then it's going to come back via the pulmonary veins. Pulmonary, think of the common theme. You got the pulmonary arteries and the pulmonary veins. So pulmonary arteries, pulmonary veins. Pulmonary veins are going to take oxygenated blood from the lungs into the left atrium. Let me get over here. Okay, the left atrium. All right, so the blood from there is going to make its way to the left ventricle, and here, this is the big superhero of the heart. I like to consider it because it's the one that's really pumping out the most blood. It's really doing the most work through the blood. If you've noticed before or earlier in the video, there's a thicker wall here that I drew on the left ventricle than the right ventricle. Why is that? Well, because when the heart takes in the blood, it causes stronger amount of pressure to get all that blood through your entire body rather than just through the lungs and then back to the heart. So that brings up the idea of different circulations. The pulmonary circulation is associated with the pulmonary arteries and the pulmonary veins and the lungs. So pulmonary circulation is just going to start with the pulmonary trunk and make its way to the lungs and then back and come back through the pulmonary veins there. So pulmonary circulation, then there's the systemic circulation. Systemic circulation is just all circulation of blood elsewhere other than the lungs. Okay, so here this guy, thick muscle, a lot of muscle to contract. We call that heart contractility. It's able to contract harder and cause more pressure, which we'll get into the aorta here. We'll talk about in just a second, and then blood can get through the entire body and keep that direction of blood flow constant. Okay, so from after given that superhero strength of pumping, that's going to go into the aorta. The aorta you probably heard of. It's the big artery at the top of the heart. That's going to carry oxygenated blood from the heart to the rest of the body, fill up your cells with all the nutrients and oxygen and whatever else they need to survive and continue dividing and doing whatever else they do. Okay, there's two different sections, or well, actually, there's more than two, but we'll talk about just two right now. Portions of the aorta. What we can see here is the ascending aorta, and then you have the aortic arch, or the arch of the aorta. The ascending aorta, that's going to have components associated with it, and same with the arch of the aorta, which I drew up here because there's more of them than the ascending, and they're also very important. They'll deliver blood to the top of your head. Here you have your left subclavian artery, and then your left common carotid artery, and then your brachiocephalic artery. We'll get into that in a different video. That's not important right now. So remember, you have your ascending aorta and then the arch of the aorta. So the ascending is coming up, and then it's going to arch around, and it's going to go down to the descending aorta, which I do not have pictured here. Okay, so this is an artery. Remember, it's going away from the heart and to the rest of the body. So just to recap here, we have the vena cava, the superior and inferior ends, then the coronary sinus, which is posterior to the heart. Can't see it in this image. Okay, so the right atrium, right atrium, right ventricle come up through to the pulmonary trunk, which will go to the pulmonary arteries, come out to the lungs, and back through to the pulmonary veins, and then to the left atrium, then the left ventricle, and then come back through to the ascending aorta, and then arch of the aorta, which will then go and branch off to countless different arteries, and it will make its way back to one of those three sections that we talked about earlier. Okay, let's talk about valves. All right, there's 4 valves within the heart. Valves are they're going to cover 25% of the function of the heart. Why are they important? Well, they're going to prevent backflow of blood. They're going to ensure that blood is going to travel in one direction and not go backwards and not go places that we don't want it to go, and it's beneficial. It's beneficial to life. Okay, so blood's going to come in, say from the right side, and it's going to enter through this valve here. Hopefully you can see it. This valve right here, and we're going to call that the the right atrioventricular valve. Okay, another name for it is the tricuspid valve. Tri, 3, cusp. It's a smooth layer of tissue. It's a smooth flap of tissue. Tricuspid. There's 3 of them, and so blood. As soon as pressure is greater in here than it is into the right ventricle, blood is going to come on through passively. 90% of heart pumping, or 90% of blood going through the atrium to the ventricle is passive work. It means the heart's not going to really do anything in order for it to get there, and then the last 10%, it's actually going to contract the atria, and get whatever left it can into the ventricle. So, as pressure is increased in the atrium,